Feeling clueless on placement? You're not alone. Every student nurse goes through it. Here's how to build confidence in every shift. Hello, you're on Shift with Sian, the platform that empowers student nurses with the knowledge, the tools and the support to build confidence in practice. Placements are designed to push you out of your comfort zone and into real life situations, and yes, feeling lost is normal. But today I'm going to share practical tips as how you can build confidence, handle anxiety and make the most out of every shift. Keep watching to find where you can find your free placement confidence checklist to start feeling confident straight away. My tips for building confidence then. Number one is normalise the feeling clueless. Feeling clueless isn't failure, it's proof that you are learning. So talk to your fellow students and share any doubts. Everyone is nervous at first. Journal your feelings to distinguish between actual knowledge gaps and normal student nerves. The mindset shift is thinking that uncertainty is part of growth. You are human, you are teachable, and every question builds that foundation. Next shift, ask one experienced nurse what they wish they'd have known as a student. Prepare before shifts. Review relevant conditions or ward routines, for example, dementia care if you're on elderly ward or pre and post-op care for surgical wards. Use resources like the NHS website, NICE guidelines or relevant journal articles. Preparation shows respect for your role and helps you to keep calm and less overwhelmed. Next shift, just spend 10 minutes the night before reading about a condition that you may encounter on that placement. Ask questions without apologising. Don't hesitate to ask, can I ask why you're doing this? Or can you show me that again? Questions show engagement, not weakness. That mindset shift is thinking that curiosity is professionalism. Every nurse that you admire asks the same questions. Next shift, ask at least one thoughtful question during your shift. Get organised with a pocket notebook. Write medical terms, medications, ward tips and reflections. It will help you during your reflections, your OSCE prep and your portfolio entries. Tracking progress turns uncertainty into clear growth. Next shift, write down 3 things you didn't know at the start of your shift and research one of those after. Find a go-to member of staff. Identify somebody, a supportive nurse or healthcare assistant for guidance. It can help when you've got questions that need answering or you need help with ward navigation or finding equipment. Seeking support is a strength and not a weakness. Next shift, ask one small question of somebody who's approachable on the ward. Introduce yourself clearly. Make your presence visible. Hello, my name is Sian, the student nurse looking after you today. Repeat this with new patients and staff. It helps staff to remember you and respect you. Introducing yourself, assert your place in the team. Next shift, introduce yourself to at least 3 new people and try and remember their names too. Celebrate the small wins. Note little achievements, remembering names or asking questions or handling tasks calmly. Track those wins in a diary or a notebook. Confidence will build in those small daily victories. You can check back on these on those days that feel really overwhelming to see how far you've come. Next shift, write one thing you handle better today than you did yesterday. Use feedback constructively. Request specific feedback. Is there anything that I could do to improve on? Reflect on patterns rather than single critiques, and don't focus on the one negative and forget about those 3 positives. Feedback is a roadmap to improvement, it's not a judgment. Next shift, ask one team member for feedback on a small task. Buddy up with another student. So connect with a fellow student to vent, swap tips or share wins. It helps to reduce isolation and normalise nerves. You're often having the same issues as they are. There is a strength in a nursing community. You won't be nursing alone when you're qualified, so start making connections now. Next shift, check in with another student nurse and share one small win with them. Fake it till you make it with boundaries. Acting confident even when you're nervous, so speak clearly, offer help and smile. Maintain professional boundaries and ask for guidance when it's needed. Confidence includes knowing your limits and asking for help. Next shift, pick one thing you were nervous about last shift and have the courage to have a go. Take care of your mental health. Watch out for signs of burnout, anxiety, tearfulness, dread. Reach out to a practice assessor or mentor, university wellbeing team, or another student. Self-care keeps you safe, strong, and effective. Don't make it the last thing that you think of. Next shift, check in with yourself after your shift. Ask, do I need rest, support, or a reset? Remember, you're not just a student. Your contribution adds value to the team, students matter, and your efforts do make a difference. Own your title as a student nurse with pride. Next shift, write a sentence reminding yourself of your value and keep it handy. Confidence doesn't come from knowing everything. It comes from showing up, asking questions, learning from feedback, and reflecting on your progress. Every shift is a chance for you to grow. Download your free pocket confidence checklist for student nurses. Keep it in your lanyard, your notebook, or your placement folder to help you stay grounded during busy shifts. If you know a fellow student that could do with this little boost of confidence, share this video with them and don't forget to subscribe. Remember, be kind to yourself. We've got this.